First, I would like to thank the organizers for inviting me to give a presentation here, especially to give you an idea what AMSE is about. You see here, AMSE is the Association of Medical Schools in Europe, and with respect to Europe, we understand with Europe not the European Union, we understand the WHO Europe, which is being, the whole world is being divided by WHO in 6 regions, and you see them here by color. And the green region, that's the European region. You see the somehow red region on the left, the region of the Americans, then the blue African, then the Eastern Mediterranean region, the Southeast Asian region in pink, and the real red in the Western Pacific region. At the moment, the WHO Europe consists of 54 countries, and at the moment about 500 to 600 medical schools are within those 5 countries, and the association represents all those medical schools, even if they are not member of AMSE. We don't have 508 members. We have around 100 members at the moment. And if somebody, and about 20 members of the member schools are here, I would like to welcome them from Europe. Thank you that you came here in order to also listen to what's happening here and to learn from others. And if somebody is from WHO Europe and is not member of AMSE, it's very easy to become member of AMSE. We have flyers outside, and you can look at that, how you can apply to become a member of AMSE. The objectives and articles, activities of AMSE, you see here. In the past, we did something about the relationship, medical school and healthcare systems, the role of medical school in postgraduate education, the Bologna process, which was very, very important for Europe. Actually, Germany, I'm coming from, we don't have bachelor and master in medicine. We think we don't need that. It wouldn't improve the medical education. Other countries did that. And we also talked about the staff of the medical schools. You see all the decorations of those activities on the AMSE website. In the last 2 years, and I became president of AMSE about 2 years ago, we deal with, especially, we focus on the quality assurance of medical schools, hospitals, I would say all the institutions which are involved in the education of medical students. Because in Germany we have a 6-year program. The first 2 years are being taught at the medical faculty. We say a faculty of medicine, like I'm a biochemist. And the next 4 years are being taught outside of that medical school in the university hospitals, in private practices. There's a lot of education going on outside of the medical school, and I think we have also to guarantee that these institutions fulfill somehow quality standards, whatever that means. And we have also some publications available on the AMSE website. Actually, we have big problems somehow to convince the parliament in Brussels, the European Parliament in Brussels, to do something like what we wanted them to do. The politicians are sometimes ignorant. Why? We focused on that. We think, and we are pretty sure, that we have some threats on the market at the moment. Not only in WHO Europe, also all over the world, we have an enormous and uncontrolled increase of medical schools. When I started to be president in AMSE, there is one country in Europe, the increase of medical schools in that one country, they nearly doubled the medical schools in that country. Also in Germany now we have an increase of medical schools. And then the question comes, what does a new medical school has to fulfill in order to be allowed to educate medical students? I'm convinced that the medical school should have research in its medical school. So it has to do education and research. Many of those new medical schools, they don't do that. For sure, they can do it cheaper if they don't do research. It just costs money. They can do it cheaper and they can do it faster, because I come to that European law in a minute. So we have new medical schools up, they do it cheaper and faster. And for sure, kids and the parents maybe tell, you go there. You are earlier medical doctor and it doesn't cost so much money. But where is the quality? If they have the same quality like the standard medical schools, the academic medical schools, I always say the non-academic and the academic medical schools, then it's fine. I'll come to the quality standards in a minute. Especially in Germany, we have the so-called franchise models. Because in Germany, there are many more students applying to become a doctor than we have places in Germany. So outside of Germany, in other countries, they open up new studies for medical education, especially made for German students. The German students enroll there in that country to the standards and everything which occurs in that country, but then the education is not done in that country where they do the enrollment. The education is done in hospitals in Germany. So they are students of that school. They get their degree and they get their doctor license in that school from that country. And because we have in Germany the free employability, they can practice wherever they want. So they go there, do it cheaper, faster than in Germany. And the partner is, I would say, sometimes a city hospital. So we have one of those collaborations where a city hospital is doing the education from year one in Germany, in the city hospital. Year one means physics, chemistry, biology. Year two means physiology, anatomy, biochemistry. As a biochemist, I ask myself, who is being able to teach biochemistry in a city hospital? So they look for partners in order to do their teaching, and I'm a little bit concerned about that, about quality. This goes in my next slide. We have a big diversity in quality, the quality assurance and the quality recognition all over the world. We just saw the slide from the former speaker. In Europe, the criteria or standards are country specific, which means each of these 54 countries defines its own quality standards. We heard about, we have the WFME standards. In Europe, we have the so-called European ESG standards. They don't have to fulfill that at the moment. The quality assurance and quality recognition are also country-specific. In Germany, for example, we don't have accreditation at all. Germany belongs to the 20% with no accreditation, which means the politicians open up a new medical school. We will have a new medical school maybe next year in Bavaria, because the prime minister in Bavaria, he retires and he wants to have its medical school with his name before he leaves. If that's good or not, I don't know. But we don't have this accreditation or quality recognition system. When you look for WHO Europe, only 60% of all the medical schools, they have an obligatory accreditation, and the rest either optional or no accreditation, and in most cases the politicians decide if there is a new medical school or not. We have also a threat of the European Parliament in Brussels. They bring out many directives, and as this directive from 2013, it's effective from 18th of January this year, and it's binding on the member states, which tells we have free employability in the European Union. We have an automatic recognition of the doctor licenses from the countries in the European Union. If you look in that, directive and you look about quality criteria, what the Brussels Parliament defines about quality, you find at least 5 years of study. They reduced the 6 years in the former directive to 5 years, so it's being faster. It's 5,500 hours. I'm not sure if the hours is quality. And it's, the training should be provided by a university, which is somehow good, or under the supervision of university. And this allows a university in country 1 in Europe to open up a study and doing the education in country 2. Because the education in country 2 is being done under the supervision of the university of another country. Therefore, AMSE asks, are we at a risk? We, academic medical school and hospitals with high education quality and research, future patients, and especially when I talk to politicians, I become more personal. I say, do you want to have your child being looked at from a doctor like that? And then they start a little bit to think about. So proposal of AMSE is medical education must be science-based. Medical education can only take place at recognized universities, medical schools and hospitals, and I mean all the institutions being involved in the education have to be somehow recognized. We have to define common standards worldwide and also in Europe. We have the WFME standards on the market, we have the European standards on the market. We should combine those somehow. They're a little bit different, and then we have to find an assurance and recognition of those standards by either the WFME, this is the ECFMG project somehow, or by the European recognized agencies. We have a European registers of agencies, and they fulfill the European standards. We should connect those two initiatives in future somehow to be more productive, because I think AMSE alone cannot do that, and I'm pretty sure that ECFMG and WFME might have also problems for recognizing all the accreditation agencies all over the world. The aim of that initiative is that the automatic recognition of doctor licenses and free employability in Europe is only if the quality standards and especially also very important, the appropriate language skills, the medical jargon of language are fulfilled. It cannot be that a doctor comes from country 1 to Germany and is treating patients, and the hospital has to engage people who translate what the doctor is telling to the patient. That's what's happening at the moment in hospitals in Germany, because the doctors don't speak good enough German to do that. And that's another proposal to require medical school education as a prerequisite for automatic recognition of doctor licenses is a significant step in its continuing efforts to enhance protection of the public. That's what I think. If you are more interested in that, I invite you to come to the next regular meeting of AMSE, which takes place in Prague, October 7, and you find all the information on the website. I have also flyers outside telling you what's being done there, and the topic of that is challenges of doctor mobility in a changing Europe, standards and recognition for patient safety. And I thank you for your attention.